Welcome. Today, we're diving into a rare and complex condition that affects not just hearing, but also balance: autoimmune inner ear disease, or AIED. AIED is believed to arise when the body's immune system mistakenly attacks the inner ear. The exact trigger for this autoimmune response remains largely unknown. In some cases, AIED is linked to other systemic autoimmune disorders, such as lupus, rheumatoid arthritis, or Cogan's syndrome. However, often occurs in isolation, making the cause difficult to pinpoint. The inner ear houses delicate structures responsible for hearing and balance. In AIED, the immune system's attack leads to inflammation and damage within these structures. This inflammation disrupts the normal function of the cochlea, which processes sound, and the vestibular system, which maintains balance. The result is a decline in hearing, often fluctuating, and problems with balance, creating dizziness and unsteadiness. AIED is a relatively uncommon condition. Due to its diagnostic challenges, the precise prevalence is difficult to determine. Estimates suggest it affects less than 1% of individuals with hearing loss. It can occur at any age, but is most frequently diagnosed in adults between their 20s and 50s. The symptoms of AIED can be quite debilitating. Rapidly progressive hearing loss is a hallmark, typically affecting both ears, although it may start in one. Tinnitus, or ringing in the ears, is also common. Balance problems such as vertigo, dizziness, and unsteadiness are frequently experienced and can significantly impact daily life. Some individuals may also report a feeling of fullness or pressure in the ears. Diagnosing AIED can be challenging as its symptoms overlap with other ear conditions. There's no single definitive test. Diagnosis relies on a combination of factors, including a detailed medical history, audiological testing to assess hearing function, balance testing to evaluate vestibular function, and blood tests to look for evidence of autoimmune activity. A positive response to immunosuppressive medication can also support the diagnosis. While there aren't strict subtypes of AIED, it's often classified based on its association with other autoimmune diseases. If AIED occurs alongside another diagnosed autoimmune condition, it's considered secondary AIED. When AIED occurs in isolation without other known autoimmune diseases, it's classified as primary AIED. The primary goal of treatment is to suppress the immune system and reduce inflammation in the inner ear. Corticosteroids, such as prednisone, are often the first-line treatment. If corticosteroids are ineffective or cause significant side effects, other immunosuppressant medications, like methotrexate or cyclophosphamide, may be used. For individuals with severe hearing loss, hearing aids or cochlear implants may be necessary to improve hearing. Vestibular rehabilitation therapy can also help manage balance problems. Unfortunately, there are no definitive ways to prevent AIED since the underlying cause is not fully understood. Early diagnosis and treatment are crucial to minimize damage to the inner ear and preserve hearing and balance function as much as possible. The prognosis of AIED varies depending on the severity of the disease and the individual's response to treatment. Early diagnosis and prompt treatment can improve the chances of stabilizing hearing and balance. However, some individuals may experience progressive hearing loss and persistent balance problems despite treatment. Recent research is focusing on identifying specific autoantibodies that target the inner ear, which could lead to more targeted therapies in the future. Studies are also exploring the potential of biological therapies, such as TF inhibitors, to modulate the immune response in AIED. The continued research offers hope for better diagnostic tools and more effective treatments for this challenging condition.